Let's talk about diarrhea. When you think about diarrhea, not only just watery stool, if you have bowel movement more than 3 times a day, we call it diarrhea. So it doesn't have to be watery stool. If you have diarrhea acutely, which means less than 2 weeks, and you just had it and usually goes away within 2 weeks, we call it acute. And this is usually from what you ate. If you ate, wrong food, infected food, contaminated water, you go to some third world countries and drink water there, get diarrhea, abdominal pain, cramps. Usually it's from infection, or sometimes allergy. You're allergic to what you ate. But usually is poison or infection. These things usually goes away by itself, but it helps if you take Pepto-Bismol, charcoal, or I usually prescribe Cipro for infection, but that you need to go see a doctor, and it's doctor's opinion. So first thing, you have to think about what you ate. Not only food and water, the medicines like laxatives, diet pills, alcohol, milk, sugar substitutes, aloe vera juice, Mylanta, Maalox, milk and magnesia, all this over-the-counter medicines could cause diarrhea. So you need to think about what you ate. Did I have a diarrhea because what I ate? You need to think about that. Also, if you are older person, then you have to think about some disease. Ischemic colitis, which is poor blood circulations, or regular colitis, viral colitis, antibiotic-induced colitis. There are many different colitis that could cause diarrhea and sometimes fever. So you need to go see a doctor and get checked out. If it's chronic, let's say more than 2 weeks, if it's not that severe, then we'll think about irritable bowel syndrome. Probably it's the most common thing. I mean, you had diarrhea a little bit, you have abdominal pain a little bit, here and there, and it comes and goes. You see a doctor, they don't have a good answer, and it really bothers you. So you take some probiotics, maybe Imodium, but it really didn't help. So you have to go see a doctor and start taking prescription medication. And probably a doctor will say, hey, you have an irritable bowel syndrome. Maybe you do. But before you say you have irritable bowel syndrome, you need to have it checked out. You need to have colonoscopy, upper endoscopy, and make sure that you have no chronic colitis, like ulcerative colitis, Crohn's disease, or other colitis. These things are chronic disease. It comes and goes, and sometimes bleed. So these ulcerative colitis type of inflammatory bowel diseases have to be diagnosed and get proper treatment. Also, if you had cancer, radiation therapy for the cancer, chemotherapy, These causes chronic diarrhea. Lactose intolerance could cause chronic diarrhea if you take milk all the time. If you are gluten intolerant and you take wheat and things, then you'll get diarrhea. So if you have chronic diarrhea, a diarrhea that just don't go away after like 2-3 weeks, you need to go see a doctor and get proper diagnosis and proper treatment. Also, in third world countries, you could have parasites. If you take some oriental medicine, that could also cause diarrhea. So, or abdominal surgery. If you had an abdominal surgery before, cut your stomach, taken out your stomach or small intestine, then you could have diarrhea. So all these things could cause diarrhea. So you need to go see a doctor.